Have you ever heard a 5 or 6 year old child having myocardial infarction? The high topic which I'm going to discuss today is a disease that can cause myocardial infarction in a 5 or 6 year old child. So, the topic which I'm going to discuss today, the high topic which I'm going to discuss today is Kawasaki disease, also called as mucocutaneous lymph node syndrome. So, what is this Kawasaki disease? It is an acute febrile illness which is self-limiting, multi-system, vasculitis of medium sized vessels. So, all these words are very, very important. So, it is an acute febrile illness which is generally self-limiting, involving multi-system and vasculitis of medium sized vessels. So, what causes this vasculitis? So, etiology, exact etiology is actually unknown, but it appears to be an aberrant immune reaction to an infection with Staph aureus, which produces the toxic SOX syndrome toxin. Okay. So, here you can see actually that there is anti-endothelial cell antibodies, also marked proliferation of poly T cells, monocytes and macrophages. Okay. So, it's basically an aberrant immune reaction where there is an anti-endothelial cell antibodies which is formed, which leads to the vasculitis of medium sized vessels. Very interestingly, and these are the two most important points probably on this topic, is first is the age. Okay. So, remember, children from 4 weeks to 12 years can be affected, are mostly affected, but if you see, more than 80% of the cases, or around 80% of the cases, are of age less than 5 years. So, probably this is a very, very high point which you have to remember. The second is the male to female preponderance. So, 5:1 is the male to female ratio of being affected. So, it's the male child which is more affected as compared to female. So, this is about Kawasaki. Let's look at quickly the clinical features. Now, if you see this disease, it is divided into 3 phases. The first phase is acute, the second phase is subacute, and the last phase is convalescence phase. Now, acute phase consists of 1 to 2 weeks. The subacute phase generally lasts for around 4 weeks, and the convalescence phase will last from 6 to 8 weeks. So, what do we see in acute phase? So, we have fever, which is seen in 100% of the cases. Along with fever, you will have bilateral non-purulent conjunctivitis. Okay. Along with that, you have some very characteristic oropharyngeal symptoms, like the lips will be red and cracked. And very interestingly, multiple times you might have read that you can see strawberry tongue. So, the tongue becomes like a strawberry where the oral papillae is enlarged and it is pink in color. The next important feature is cervical lymphadenopathy, which is in most of the cases unilateral. Okay, so cervical lymphadenopathy. Then also you have got erythematous patches on feet and hand. Also, you can have polymorphous rash. So these are various clinical features which you see in the acute phase, generally last from 1 to 2 weeks. So end of the fever marks the end of the acute phase. Let's look at what happens in the subacute phase. So in the subacute phase, there is no fever. However, there are some other symptoms. Most importantly, there will be desquamation, which is the skin will start peeling off in the feet and the hand. You can also have arthritis, arthralgia. There are some very, severe complications of this disease which can lead to a lot of morbidity and mortality, especially the cardiovascular complications. And it is in this stage generally these complications are seen. So what are the important cardiovascular complications? So you will have myocarditis, pericarditis. You can have even ventricular arrhythmias. You can also have, because of the destruction of the muscular layer, you can have aneurysms formation also. So remember, it is these cardiovascular complications which are a very important cause of the morbidity and mortality in this patient. Okay. So a lot of, because it is a self-limiting disorder, but still there are some very specific treatment which we give to these patients to reduce the instance of this cardiovascular morbidity or mortality. And I told you that we are talking about a disease which can cause a myocardial infarction in a 5-year-old or a 6-year-old child, and this is why it will cause this myocarditis and pericarditis and all those cardiovascular complications, coronary artery complications can cause myocardial infarction in children. Let's look at the next phase, that is the convalescence phase. So here what happens, it is basically once all the symptoms subside too. So this is the period when there is no symptoms but ESR is raised. So from the period when there is no symptoms to normalization of ESR. Okay. So once the ESR is normalized, then this phase ends. So it will be, which means that once the symptom is, there is no more symptom, it will take 6 to 8 weeks for normalization of ESR. Is this clear? Having learned the clinical feature, let's quickly learn about the diagnostic criteria. So in diagnostic criteria, remember, fever is an essential diagnostic criteria, and then 4 out of 5 of the below clinical feature which I have already discussed. So one will be bilateral non-purulent conjunctivitis, also oropharyngeal symptoms like red cracked lips or strawberry tongue. Then also cervical lymphadenopathy, which I have told you that primarily it is unilateral. Edema of hand and feet, which may later be desquamation may be there. And finally, again, presence of polymorphous rash. Okay, so fever has to be there, and out of these 4 out of these 5 has to be there to confirm a diagnosis of Kawasaki disease or mucocutaneous lymph node syndrome. So how do we manage this patient? So remember, our primary concern is, because it's a self-limiting disorder, our primary concern is to reduce the morbidity and mortality of these patients, which is primarily, because of the coronary vessel, involvement. So there are two drugs. We can give IgIV or IV gamma globulin at a dose of 2 milligram per kg body weight. Okay, and this is especially important in the first 10 days, because if you don't administer the treatment in the first 10 days, then you will not be able to reduce the incidence of coronary or cardiovascular complication. Another very important is very high dose aspirin. High dose aspirin, which is like 80 to 100 milligram per kg body weight, divided into 4 doses. And remember, both of these can actually reduce the risk of cardiovascular disease from 20% to 5%. If there is a cardiovascular, a complication which has happened, long-term sequel, then we will continue aspirin on a lower dose. Another very, very important thing is, remember, because we are trying to look for cardiovascular complications, a lot of these patients should be evaluated for all the cardiac, for example, 2D echo and all has to be done in these patients. So this, kind of completes our discussion on Kawasaki syndrome. But before I end the lecture, let me just quickly tell you what are the questions or what are the points which you have to essentially remember. So let me start from the first. So remember, first of all, it's an acute febrile disease, and the vasculitis is primarily involving the medium-sized vessel. So this has been asked in the question. Second is, it is associated with staph aureus infection. Okay, it's an aberrant immune response to an infection, and anti-endothelial cells antibodies are seen. Very important, more than 80% of the cases have age less than 5 years, and the male to female ratio is 5:1. Then you know about the acute phase, subacute phase, convalescence phase. But the most important thing which you have to remember here is obviously the clinical features which will form a part of the diagnostic criteria, but primarily about the cardiovascular complications. Okay, and what do we do for the cardiovascular complication? So that you have to remember, we give IgIV or IVGG or high dose aspirin. So these are the very, very important points which you have to remember about this topic. Now, these series of HYTs are very, very crucial for you to know the important topics and know what kind of questions you can expect on these topics.